Master the B drugs. Here's a list of the 25 most common medications tested arranged in alphabetical order. How many do you recognize? Try to say the drug action before I say it. Baclofen is used to treat muscle spasms and spasticity. Bactrim, sulfamethoxazole or trimethoprim, is used to treat various bacterial infections, including urinary tract infections and respiratory infections. Beclomethasone is used to prevent and control asthma symptoms and to treat allergic rhinitis. Benazepril is used to treat high blood pressure and heart failure. Benadryl diphenhydramine is used to treat allergic reactions, insomnia, and motion sickness. Benzonatate is used to relieve cough. Bumetanide is used to treat edema, fluid retention, associated with heart failure, liver disease, or kidney disease. Buprenorphine is used to treat opioid dependence and moderate to severe pain. Bupropion is used to treat depression and as an aid to stop smoking. Buspirone is used to treat anxiety disorders. But albuterol, acetaminophen, caffeine is used to treat tension headaches. Betamethasone is used to treat inflammatory conditions such as severe allergies, arthritis, and skin conditions. Bicalutamide is used to treat prostate cancer. Bimatoprost is used to treat glaucoma and ocular hypertension and to promote eyelash growth. Bisocodyl is used to treat constipation. Bismuth subsalicylate is used to treat diarrhea, indigestion, heartburn, and nausea. Bivalirudin is used as an anticoagulant in patients undergoing percutaneous coronary intervention, PCI. Bleomycin is used in the treatment of various cancers, including Hodgkin lymphoma and testicular cancer. Bortezomib is used to treat multiple myeloma and mantle cell lymphoma. Bosentan is used to treat pulmonary arterial hypertension, PAH. Brexpiprazole is used to treat schizophrenia and as an add-on treatment for major depressive disorder. Bromocriptine is used to treat Parkinson's disease, hyperprolactinemia, and type 2 diabetes. Budesonide is used to prevent and control asthma symptoms and to treat Crohn's disease and ulcerative colitis. Busulfan is used in chemotherapy to treat chronic myeloid leukemia and as a conditioning agent before bone marrow transplantation. Let's keep going. Here are the adverse reactions of the B drugs. Baclofen. Adverse reactions: drowsiness, dizziness, weakness, fatigue, nausea, confusion, headache, insomnia. Bactrim adverse reactions: nausea, vomiting, diarrhea, rash, can be severe, e.g. SJS-10. Photosensitivity, crystalluria, bone marrow suppression, e.g. leukopenia, thrombocytopenia. Beclomethasone. Adverse reactions: oral candidiasis, thrush, dysphonia, hoarseness, cough, headache, pharyngitis. Benazepril. Adverse reactions: cough, dry, persistent, dizziness, fatigue, headache, hypotension, hyperkalemia, angioedema, rare but serious. Benadryl adverse reactions: drowsiness, dizziness, dry mouth, blurred vision, urinary retention, constipation, paradoxical excitation in children. Benzonatate or tessalon-perlizumab. Adverse reactions: drowsiness, dizziness, headache, nausea, constipation, numbness in throat or mouth if chewed/crushed. Betamethasone. Adverse reactions: systemic use, fluid retention, hypertension, hyperglycemia, increased appetite, weight gain, mood changes, insomnia, osteoporosis long-term. Increased infection risk. Topical use: skin atrophy, burning, itching. Bicalutamide. Adverse reactions: hot flashes, breast pain/tenderness, nausea, diarrhea, asthenia, weakness. Liver enzyme elevation. Bimatoprost. Adverse reactions: ocular hyperemia, redness, eye pruritus, itching, eyelash changes, growth, darkening, iris pigmentation changes, blurred vision. Bisocodyl or Dulcolex. Adverse reactions: abdominal cramps, nausea, diarrhea, rectal irritation, suppositories. Bismuth subsalicylate or Pepto-Bismol. Adverse reactions: darkening of stool, tongue, harmless. constipation, tinnitus at high doses, bivalirudin, adverse reactions, bleeding, hemorrhage, headache, nausea, back pain, hypotension, bleomycin. Adverse reactions, pulmonary fibrosis, bleomycin lung, skin hyperpigmentation, fever, chills, alopecia, stomatitis, hypersensitivity reactions, bortezomib adverse reactions, peripheral neuropathy, thrombocytopenia, neutropenia, fatigue, nausea, diarrhea, constipation, bosentan adverse reactions, liver enzyme elevation, headache, edema, anemia, flushing, hypersensitivity reactions, brexpiprazole adverse reactions, akathisia, restlessness, weight gain, somnolence, dizziness, nausea, constipation. Let's finish strong by doing the contraindications or black box warnings of the B drugs. Baclofen. Contraindications / black box warning. Hypersensitivity to baclofen. No black box warning, but abrupt discontinuation of intrathecal baclofen can lead to severe withdrawal symptoms. For example, high fever, altered mental status, exaggerated spasticity, muscle rigidity, rhabdomyolysis, multiple organ system failure, and death. Bactrim contraindications / black box warning. Marked hepatic damage, severe renal impairment when renal function cannot be monitored, megaloblastic anemia due to folate deficiency, infants less than 2 months of age, hypersensitivity to sulfonamides or trimethoprim. No black box warning, but severe adverse reactions, for example, SJS, TN, hepatic necrosis, aplastic anemia, are emphasized. Beclomethasone contraindications / black box warning. Primary treatment of the status asthmaticus or other acute episodes of asthma where intensive measures are required. Hypersensitivity to beclomethasone. No black box warning. Benazepril or lutein contraindications black box warning. Black box warning. Fetal toxicity. Discontinue as soon as pregnancy is detected. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. Contraindications. History of angioedema related to previous ACE inhibitor treatment, hereditary or idiopathic angioedema, concomitant use with aliskiren in patients with diabetes or renal impairment, Benadryl or diphenhydramine. Contraindications / black box warning. Hypersensitivity to diphenhydramine. Newborn or premature infants, breastfeeding mothers. Not for use as a local anesthetic in patients with known sensitivity to other local anesthetics of the ester type. No black box warning. Benzonatate or Tessalon Perles. Contraindications / black box warning. Hypersensitivity to benzonatate or related compounds, for example, tetracaine, procaine. No black box warning, but accidental ingestion by children can be fatal. Betamethasone contraindications, black box warning. Systemic fungal infections for systemic use. Hypersensitivity to betamethasone. No black box warning. Bicalutamide contraindications, black box warning. Black box warning. Increased mortality in patients with prostate cancer when used as monotherapy. Note, primarily used in combination with LHRH analogs. Contraindications. Pregnancy can cause fetal alarm. Almamas aminian mom. Use in women then hypersensitivity to bicalutamide, bimatoprost or lattice contraindications, black box warning. Hypersensitivity to bimatoprost or any component. No black box warning. Bisacodyl or Dulcolex. Contraindications or black box warning. Abdominal pain, nausea, vomiting, or other symptoms of appendicitis or acute surgical abdomen. Fecal impaction, intestinal obstruction. No black box warning. Bismuth, subsalicylate, or Pepto-Bismol. Contraindications, black box warning. Children / teenagers recovering from chickenpox or flu-like symptoms due to risk of Reyes syndrome if aspirin-containing products are used concurrently. Hypersensitivity to salicylates, active gastrointestinal bleeding, ulcer. No black box warning. Bivalirudin, contraindications, black box Warning, active major bleeding, hypersensitivity to bivalirudin or hirudin. No black box ocean warning. Bleomycin contraindications, black box warning. Black box almine warning. Pulmonary fibrosis, it can cause fatal pulmonary fibrosis, which is dose-related. Monitoring for pulmonary toxicity is essential. Anaphylactoid reactions can cause severe or fatal idiosyncratic reactions similar to anaphylaxis, usually after the first or second dose. Contraindications, hypersensitivity to bleomycin. Bortezomib, contraindications or black box warning. Hypersensitivity to bortezomib, boron, or mannitol. Intrathecal administration is contraindicated, can be fatal. No black box warning, but specific administration routes are critical. Bosentan contraindications, black box. Warning, black box, warnings, hepatotoxicity, significant liver injury has been reported. Regular monitoring of liver function tests is required. Embryo-fetal toxicity, contraindicated in pregnant women and women of childbearing potential not using reliable contraception. Contraindications, pregnancy, concurrent use of cyclosporine A or glyburide, hypersensitivity to bosentan. Brexpiprazole or Rexulti contraindications black box. Warning, black box. Warnings, increased mortality in elderly patients with dementia-related psychosis. Atypical antipsychotics increase the risk of death when used in elderly patients with dementia-related psychosis. Brexpiprazole is not approved for this use. Suicidal thoughts and behaviors. Increased risk of suicidal thoughts and behaviors in children, adolescents, and young adults taking antidepressants, including brexpiprazole for depression indication. Contraindications. Hypersensitivity to brexpiprazole. Bromocriptine, contraindications, black box warning, uncontrolled hypertension, toxemia of pregnancy, hypersensitivity to ergot alkaloids. For cycloset, syncope for type 2 diabetes, no black box warning. Budesonide or Pulmicort. Contraindications of black box warning. Primary treatment of status asthmaticus or other acute episodes of asthma, inhaled form. Hypersensitivity to budesonide. No black box warning. Bumetanide or Bomex contraindications / black box warning. Anuria, hepatic coma, or severe electrolyte depletion until the condition is improved or corrected. Hypersensitivity to bumetanide. No black box warning. Bupivacaine contraindications, black box warning. Intravenous regional anesthesia, beer block, as it can cause cardiac arrest or death. Obstetric paracervical block anesthesia, risk of fetal bradycardia, death. Hypersensitivity to bupivacaine or other amide-type local anesthetics. No black box warning. Buprenorphine or Subutex, Suboxone contraindications, black box warning. Black box warning for transmucosal forms and opioid dependence. Risk of serious or fatal respiratory depression, especially with concomitant benzodiazepine use. Accidental ingestion, especially by children, can cause fatal respiratory depression. Contraindications. Hypersensitivity to buprenorphine or naloxone for Suboxone. Bupropion or Wellbutrin. Contraindications / black box. Warning, black box. Warning, increased risk of suicidal thoughts and behavior in children, adolescents, and young adults with major depressive disorder and other psychiatric disorders. Contraindications, seizure disorder, history of anorexia, nervosa or bulimia, abrupt discontinuation of alcohol or sedatives, including benzodiazepines, concomitant use with MAOIs, or within 14 days. Hypersensitivity to bupropion. Buspirone or Buspar contraindications, black box warning, concomitant use with MAOIs, or within 14 days of discontinuing. Hypersensitivity to buspirone, no black box warning. Busulfan contraindications / black box warning. Black box warning, myelosuppression, severe and prolonged, is the primary dose-limiting toxicity. Adequate monitoring of blood counts is essential. Contraindications, hypersensitivity to busulfan, butalbital, acetaminophen, caffeine or thiodiuracet. Contraindications, black box warning. Hypersensitivity to any component, porphyria. No black box warning, but due to the butalbital component, there is a risk of dependence and withdrawal in acetaminophen overdose risk. This information is for educational purposes and should not replace comprehensive drug references or professional medical advice.